This is TTAPS Part 2. You're going to learn a lot of valuable diagnostic issues right at the start and a lot of very valuable treatment and rehab issues as we get into this film. So now we're going to start with the diagnostic muscle testing. Initially, you're going to take someone and you're going to be behind them, and each time before you start the muscle testing, you tell the patient, I'm going to put you in several different positions. I'm going to ask you to resist. I just want you to keep me from moving it and don't try to push back against me. You can have a weakness revealed by an abject weakness or a jittery weakness. Either one of those counts as a weakness. So we're going to start with cervicals. Now, you always want to put the patient in the most disadvantageous position so they can't be super strong against you, but you don't have to push real hard either to show the weakness. So we're going to do neck flexion. You have them slightly flexed, not fully. You're going to ask them to resist, and then you're going to come to the front and ask resist. Then you're going to tilt backwards slightly. You're going to do the same. Resist, resist. You're going to tilt to the side. Resist, resist. Tilt to the other side. Resist, resist. And you're going to do a rotation. Now here you want to put your fingers on the cheekbone and you're going to place both of your hands. You're going to resist one way, resist, and the other way, resist. And slightly turn the other way. Resist, resist. That's the neck. You're going to test the upper trapezius. So you have them turn the face away because the trapezius attaches to the spinous processes and then down into the shoulder. You're going to have them slightly lift the chin, slightly lift the shoulder, and hold right there, resist. And you're going to have them drop down, turn the other way. Lift, resist. Now we're going to test the other trapezius muscles. First one, palm is up, elbow is rigid. You're going to stabilize the shoulder. You're going to press at the wrist going forward. This is the middle trapezius. Resist, and you go up about 15 or 20 degrees. This is the lower trapezius. Resist. And you do the other side. Resist, resist. So the arms are bent at 90 degrees, elbows straight out from the shoulders. You're going to press straight down from the middle deltoids. Resist. And you're going to tilt down and forward. You're going to press with the plane of the forearms. You have this patient step slightly forward with one foot so they don't stumble. Step forward with one foot. And you're going to push down at the angle of the forearm. Resist, and that's the posterior deltoids. Now you're going to lift the forearms up. And you have an angle here. This is the anterior deltoid. You're going to pull down and backwards. Resist. Take the hand behind the head. This is for the Coracobrachialis. It's the hairbrush muscle. Stabilize the shoulder, grab the wrist, pull straight away from the body. And we're going to have the rhomboids. Rhomboids have the elbow slightly away from center. Have them hold it there. You merely pull away from the midline. And we're going to have the Teres Major. Back of the hands on the back of the hips. Again, your foot is stepped forward, and you're just going to push straight forward. And you drop the arm down. You're going to have them lock the elbow out, full pronation. You're going to pull straight away from the body. Latissimus dorsi. Resist. And resist. Here we're going to test the TMJ muscles. You have the patient slightly open the mouth. You're going to push down, resist, and then you're going to push up, resist. And you're going to have them deviate slightly to one side. You're going to push laterally, then medially, and slightly deviate to the other side. Push laterally and medially again. Since you're in this position, we're going to go for the pectoralis major. Now here you have the arms straight out from the shoulders, the elbows locked, thumbs in the down position. While you're testing all the pectorals, you're going to stay exactly in this position. So you're going to be at the wrist, you're going to push directly outward for the clavicular, you're going to push down and out for the, straight out for the sternal, down and out for the clavicular, up and out for the costal, straight up for the abdominal division. Since you're in that position, you pull out about 15 degrees. Still elbows locked, thumbs down. You're going to push straight down, supraspinatus. And you're going to come up. If you remember the Karate Kid, the very first Karate Kid movie, going to have the arms up like this, elbows still locked up, hands down, and you push straight down. And this is the Serratus Anticus. Now we're going to do the biceps, only we're going to split the heads. Elbows straight. Again, hands straight from the shoulder, elbows locked, palms up. You're going to push straight down for the medial head. Then you take the arms outward, straight out to the side, still shoulder level, elbows locked, palms up, push straight down, lateral head. Now we're going to do the infraspinatus. The elbows straight out to the side. Now we're up at 90 degrees. You're going to stabilize the shoulder. This is for the infraspinatus. You're going to pull forward toward yourself. Pull forward. Resist. Now you're resisting back there. Now we drop down. The elbows are at 90 degrees. Thumbs up this time. Thumbs up, and you're going to push straight down, Brachioradialis. Now we have the triceps. You have 3 triceps heads. One attaches over the shoulder joint. General triceps, you have the arm straight down to the side, forearm bent up about 90 degrees, palm toward the patient, stabilize the shoulder, press straight forward. And you're going to let the arm drop to the back. Extend the arm out. Still palm is down, just the same position. Elbow lock this time, you're going to pull straight forward. That's the long head of the triceps. So we have general triceps here. And we keep the palm in the same position, lock out in the back. Long head of the triceps. Now the subscapularis. Elbow is straight to the side. Forearm is not all the way into the body, but close to it. You're going to stabilize the opposite shoulder. The palm is toward the patient. You're going to pull away from the patient. Subscapularis. Now we're going to test the pronators and supinators. Here, the testor, the person doing the testing, crosses at the wrist, the hands, and the palms are up. Now, you ask the patient to shake your hands. Just stick the arms forward, shake the hands. It's like this. You notice the patient's arms are bent at 90 degrees. They're not straight out like this. Now, they are in the pronated position. You ask to resist. You're trying to take them out of the pronated position. That means you're testing the pronators. Now you just flip the hands over. That's the only change in position. Now they're in the supinated position. Now you're going to ask to resist, trying to take it into pronation. That means you're testing the supinators. Now you're going to have the patient with the elbows at 90 degrees. Pull the fingers back into the extended position. Here you're going to test each digit individually from the last knuckle, not from the tip of the finger. And you're just going to put a light pressure. This is a weak muscle to start with. So you're going to say resist, 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 resist. And you're going to have them make a fist. That's the digital extensors. You're going to have them extend the wrist. Now you're going to test the wrist extensors. So resist, 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 resist. Now the wrist extensors. Now you're just going to have them flip the hands over and slightly curl the fingers. Now this time you're going to test from the tip of the finger. This is the digital flexors. Resist, 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 resist. And you have them curl the hand and flex the wrist. Now you're going to do the wrist flexors. Resist, resist, resist. Keep them bent like this. Resist, resist, grip and flex, wrist flexors. Now you're going to have them flatten the hand out since you're in this position. Adduct the wrist. You have the wrist adductors. You're just going to grab under the wrist, just take the hand and try and pull it outward. Now you're going to have them take the hand outward. This is the abductors. You're going to do the same, just try and pull it in. Now you're going to do the digital abductors, abductors. Here you're going to take on the distal ends of the fingers, just going to try and lightly pull them together. 2 fingers at a time. I usually do both hands at the same time. Then you're going to have them pull the fingers together and the thumbs. You're going to try and pull them apart, just like this. It's the adductors. You're going to record each one of these digital things. You're going to record the individual digits that aren't working, not just, and you're going to see the wisdom of this when we tell you how to do the correction. Now you want to do the pinchers. So you're going to have the patient pinch the fingers, and they may try to pinch with the fingers flat against each other. That's not correct. They're going to try and hook one finger over the other. That's not correct. You always say tip to tip. Now these you're going to test in 2 different ways. You're going to try and pull the fingers apart, and you're going to try and pull the fingers, one finger through them. Then you go to the next one. Pull the fingers apart, pull the finger through. Pull the fingers apart, pull the fingers through. Pull the fingers apart, pull the fingers through. Pull the fingers apart, pull the finger 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 through. Now you notice when I had, first we are having the patient turn away from you. We're trying to conserve every motion so that we're getting every specific one and just flowing one into the other. Instead of you having to walk around the patient, you have the patient turn toward you. This makes everything a whole lot easier and flow better. We're going to test the gastrocnemius. The foot is very slightly in the plantar flex position. And you take your fists and you go against the ball and forefoot. You say resist. And you take the legs up to 90 degrees, still. Just let it go up to 90, right there. Still in the partially flexed position. Take your hand and your fist thus, and you say resist, and you push down. First one is gastrocnemius, this is soleus. And you're going to bring the knees and the heels together. You're going to grab around the ankles, about the calcaneus. You're going to try and pull apart. That's the piriformis. You're going to drop one leg down. The foot is flat with the table. You're going to internally rotate. Not like this. No plantar flexion, just internal rotation. You're going to have the patient hold it there. Put the butt of your hand against the heel. Butt of your hand against the ball of the foot. Say resist. That's the popliteus. While you're in that position, you drop the leg down about 30 degrees or so. You're going to stabilize the opposite hip and press down and out. The semi-membranosus and tendinosus, you're stabilizing the opposite hip. Then you stabilize the same side hip and you're going to press down and in. That's the biceps femoris. Then knee back to 90 degrees. You're going to lift up, straight up, stabilize the opposite hip. Put your hand behind the knee, push straight down, gluteus maximus. So here, foot internally rotated, resist. That's the popliteus. You're going to drop it about 30 degrees, stabilize the opposite hip, push down and out, semi-membranosus and tendinosus, down and in, biceps femoris, back up to 90 degrees, lift the legs straight up, stabilize the opposite hip, put your hand behind the knee, push straight down, gluteus maximus. You can always stay on one side while you're doing this. You're going to have them bend the lower knee to stabilize themselves. And the leg is straight. You're holding it up, you're stabilizing at the hip. The foot is parallel with the ground. You push straight down at the ankle, gluteus medius. Turn the foot inward, same position, knee locked, push straight down, gluteus minimus. And you have the patient roll on the other side. You're staying on the same side. Bend the lower knee so that they stabilize themselves. Leg is straight, stabilize the hip. Foot is parallel with the ground, push straight down at the ankle, gluteus medius. Turn the foot inward rotation, push straight down, gluteus minimus. Now you're going to test the toe flexors. Now you should only do this 1 foot at a time because the feet are going to tend to cramp if they hold it for too long. So it's going to be just like the hand, only this time they're going to curl about fully, and you're going to come up under the tip of the toes. So you always have the patient look at your hands, say, I want you to curl your toes, because they don't really know what that means. So curl the toes just on this side and resist, 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 resist. This side, resist, 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 resist. And you're going to record the individual digits again, just like on the hands. Now you're going to have them pull the toes back toward their head. You're going to test the toe extensors. Again, this is going to be from the distal knuckle, distal interphalangeal joint. So you're going to say resist, 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 resist. Remember, these are light pressure because there is not a lot of strength in those toes. See, in all of these that we're talking about here, we're not using very much strength at all. We're putting the patient in a disadvantageous position, so you don't have to use a lot of strength, and it's very evident if the patient is weak. Now, this next one is the only one where you don't actually do any muscle testing. This is an observation. You tell the patient to spread their toes, and you're looking to see if the toes spread or if they don't. You record the ones that don't. Now spread the toes over here. Then we're going to have them pull the toes together. However, usually they're going to have to curl the foot, curl the toes to do this resistance. And you're going to try and pull the toes apart individually. Pull these together. So first are the abductors, spreading the toes, and you're pulling the toes together, the adductors, and you're recording the individual weak toes. Now, since you're in this position, you're going to have the patient dorsiflex, tibialis anticus. You grab both feet. You're going to try and pull it into plantar flexion. So they're dorsiflexed. You're going to try and pull it in plantar flexion. Since you're in this position, the peroneus muscles pull the foot up and out. So they dorsiflex and kick the foot out. You're just going to grab the foot and try and rotate it in like so as they resist. Now, since you're in that position, you have them hold the feet together. You're going to go between the heels, try and pull apart. That's gracilis. It's the adductors. Then you're going to lift slightly pull the legs out, turn the feet in. You're going to push down and in. Tensor fascia lata. You're going to pull the knees to 90 degrees. The feet are together. You're going to have the patient lightly separate the knees. You're going to push outward to test the adductor magnus and longus. And you're having to drop the leg out a little bit further. You're going to test all the external rotators of the hips, just like this. At a 90-degree angle, you're going to pull the shin up so that it's parallel with the table. You're going to stabilize the knee. You're going to push straight down. That's the quadriceps group. So you're pushing straight down at the ankle while you're stabilizing the knee. Now, there's a long head that attaches above the hip. So you still have to do that one. So you're going to have them straighten the knee out. You're going to stabilize the opposite hip, have them hold the leg up, and you're going to push straight down. That's for the rectus femoris. So you go to the other side. You don't even need to walk around the table. Push straight down with the knee bent. And you're going to straighten it out. You're going to stabilize the opposite hip. Push straight down with the knee locked. Rectus femoris. The first one is the general quadriceps group. Now, while you're in that position, first position, after you do the rectus femoris, and you're going to have them turn the foot outward, keep the knee locked, keep it in the same position. You're going to stabilize the opposite hip, push down and out psoas, straight down iliacus. Down and out psoas, straight down, iliacus. Now while you're in this position, you cross the ankle below the kneecap. You stabilize the knee, you grab the heel, you attempt to straighten the leg out. This is the sartorius. Remember, you want the ankle below the kneecap, and you have to tell them to resist. And you're just doing one side at a time. So basically what this would look like would be resist here, let it go straight, resist here, turn it out, resist here, and resist here. That's a good flow. You notice you're keeping the patient in relatively the same position. I'm in relatively the same position. So you're not having to tell the patient stand up, lay down, lay on your side, lay prone, lay supine, sit up. It's all in a flow so that you're not wasting time and effort. Now, we're going to go to the head of the table. Here you have the patient just shrug their shoulders forward, forward. You're going to push straight down, pectoralis minor, headward and down. And that's the subclavicular. So I'm going to do it on the other side because of what we're going to do right after it. So the shoulders are shrugged straight forward, pectoralis minor, subclavicular. You have the patient cross the arms right here. You're going to stabilize them. Since you're in that position, you're going to put your forearms above the kneecap to stabilize them. You're going to have them do a half sit-up. You're going to put your hand behind their neck. Say, okay, do a half sit-up. When they're halfway, put your hand on the upper sternum, push straight back, rectus femoris. Now you're going to have them twist slightly one way. You're going to push with the line of the shoulders, abdominal obliques, and then just twist them the other way, abdominal obliques again. You can do this on a table. Normally a chair is best. You're going to pin their knees between your knees, basically to stabilize them. You're going to have them tilt slightly backwards. You're going to push and pull. You're going to have them lean slightly forward, push and pull, just exactly like in the neck. And you're going to have them tilt slightly one way, push the other, slightly the other way, push one way, then the other. And you're going to have them slightly twist, try and twist one way, twist the other, slightly twist the other way, twist, twist. Now that's all the muscle testing. Now after you've done all the muscle testing, basically what you do is you're looking at all of the weak muscles, no matter where they are. You may have 3, you may have 53 weak muscles. And you've recorded every single weak muscle, including every single digit. What you're looking for is the smallest, most insignificant weak muscle. Now, the concept behind this is the weakest link. When you pull on both ends of a chain, you break the chain, it's the weakest link that goes. Well, the body is a whole lot like that. You may have dozens of injuries over a period of time, and you have all sorts of different withdrawal patterns from those injuries that are stuck in your brain. Now it's up to you to erase the memory of those injuries from the brain. In applied kinesiology, you basically do it one muscle at a time. When we're doing it this way, all you got to do is one muscle, and it's going to automatically strengthen all the muscles. The only exception being, if there's a significant amount of atrophy, it's going to take a little longer for that to occur. Most usually, the most atrophied muscles are the muscles that abduct the toes. That's the most usual one. Now, you're going to look for the smallest, most insignificant weak muscle. And it's got to be unilateral, not bilateral. So as you're looking and scanning down all the muscles, you're going to look at the muscles that are unilaterally weak. For example, you have 5 fingers that are weak on one hand and you have 2 on the other hand, then these are going to be unilateral, for example, and this is going to be unilateral. So the smallest, most insignificant muscle is going to be the smaller digit on the hand. Now if it comes between the fingers and the toes are always going to be the smallest, most insignificant muscle. Now, it's very important that you test all the muscles when you do this, because you never know which ones are going to be weak, and I've seen very bizarre things happen when you do this. For one thing, the person immediately feels more stable after you do this. A lot of times a significant amount of pain goes away because you've just caused a lot of very tense muscles to relax, very untense muscles to tone. Now, when you're doing this, you always ask the patient how they feel afterwards, because you don't want them to mistake it happening afterwards. They're going to notice all the muscles coming strong, because you're going to go right back and you're going to retest all of those muscles. And it's going to be astounding. For example, in Colorado Springs, when I did this on a female chiropractor, she was 42, she had had a stroke when she was 16. So we're talking 26 years earlier she had a stroke. Since that time, and she showed the whole class, she was not able to bring her fingers together more than this. Maybe 1.5 inches, 2 inches apart. Immediately after I did this on her, she was able to touch all fingers, and even so much so that I couldn't pull my finger through. She came back just a few minutes later, she says, "I can't believe this. I even have dexterity." A female chiropractor called me just unbelieving what happened, because she had a 7-year-old that was shot in the eye with a BB gun. Immediately one eye crossed. Nobody could figure out how to uncross it. So she remembered this, and she tested all the muscles, and I'm going to describe how to do it. She lightly tapped the opposite side, just like this, the opposite side muscle. It only takes 2 or 3 taps, no more than that. You don't have to slap it, you don't have to bear down on it. It's just like this in the belly of the muscle. She said immediately his eye came forward. And it happened to be a muscle, it was a toe muscle. Isn't that bizarre? But we see these kind of results all the time. So basically, in Guyton's physiology, it says that sometimes pain muscles can be stimulated by no more than light touch. Now, you have the example of a hot plate. When you touch a hot plate, you withdraw. And you have contraction of the biceps, relaxation of the triceps, the pectoralis relaxes, the lats contract, and you have cross-extensor reflex, just the opposite on the other side. Your torso rotates away from the hot plate, and your body pushes away, so you have a reaction through your whole body. It's a cascade effect. So if that gets stuck in the brain and it stays there, then you're going to be working on all these things, trying to figure out, what to do, and you have all of these and you just couldn't put it together. This is one way to put it all together. Again, you go to the opposite side, because if the reaction is here, 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 then the correction, without doing damage like the first one was, is to go to the other side and lightly tap like this. So it relatively does just the opposite, and it corrects all the muscle weaknesses. So basically what you're doing is you're erasing the memory of the injury or injuries from the brain, and all the muscles go to normal tonus. This is the end of muscle testing and correction. I'm going to put you in several different positions, and I want you to just stay in that position, keep me from moving it, don't try and push back on me. Alright? Yeah. Head forward there, resist, resist, back, resist, resist, to the side, resist, resist, to this side, resist, resist, turn, resist, resist, turn here, resist, resist. Take this up here, lift this, hold it just like that. Resist. Now this side. Resist. Take your arm out, lock right there, resist. Here, resist. Resist. Here, resist. Here, resist. Step forward slightly. Just 1 foot. 1 foot. Resist. Let go. Resist. Here, resist. Here, resist. Here, resist. There, resist. Here, resist. Right there, resist. Resist. Here, resist. Turn and face me. Slightly open your mouth. Resist. Resist. Slightly deviate. Resist. Deviate. Resist. Now this way. Resist. Resist. Now here, hold just like that. Resist. 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 Now here, resist. Here, resist. There, resist. Resist. Just like this. Resist here, let it down. Resist. Right there. Hold it. Resist. Right there. Resist. Let it down. Resist. Here. Right there. Resist. Here. Okay, resist when I twist. Let it go. Resist when I go back. And go like this. Resist. 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 Now like that. Here. Resist. 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 Like that. Go like so. Resist. 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 Like this. Resist. 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 And go like this. Resist. Go like that. Resist. And go like this. Resist. 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 And pull them together. Resist. 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 Now pinch the tips. Resist. Resist this one. Resist. Resist that one. Resist. Tips. Yeah. Resist that one. Tips. Resist. Resist. Now this side. Resist. 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 Now bend up here, hold them right there. Resist. Now let this down, turn here, hold it there. Resist. This one right there, resist. Now knees, heels together, right there, resist. Now let this down. Okay, now resist when I push here, resist here. Now hold this up like this, resist. Right there, excuse me, right there. Resist here, up like so, resist. Now lay on this side, bend your lower knee, Hold right there, resist, turn your foot, resist. Now lay on your other side. Bend here, resist, and here, resist. Okay, lay on your back. Alright, now look at my hand. I want you to do this on this foot. Resist, 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 resist. This one, resist, 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 resist. Pull your toes back toward your head. Here, just like that. Pull them back. Pull them back this way. Resist, 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 resist. Hold it there. Resist, resist. Hold your heels together. Resist. Resist here. Let it go. Resist here. Good. Now I want you to spread your toes out. Okay, now pull your toes together real tight. Resist, 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 resist. Hold right there. Let your knees apart slightly. Resist here. Let them out a little further. Resist here. Hold this right here. Resist. Now straighten your knee. Resist here. Turn out. Resist here. Resist here. Cross over like this. Resist. Bend. Okay, resist here. Now straighten. Resist here. Now turn. Resist here. Resist here. Let it down right there. Resist. Shrug your shoulders forward. Forward. Resist here. Resist here. Cross here. Do a half sit up. Right there. Resist. Now turn. Resist. Turn here. Resist. Okay. Alright. Now lean back. Resist here. Resist here. Lean forward. Resist here. Resist here. Tilt. Resist here. Resist here. Tilt. Resist here. Resist here. Twist. Resist here. Resist here. Twist. Resist here. Resist here. That's it. Okay. Alright, I'm going to press firmly several areas all over your body. I want you to tell me if it's tender, sore, painful, just plain hurts, hypersensitive, or ticklish. And I want you to tell me if it's just on one side or it's on both sides. Okay? We're going to go in the crevice behind the ears. And we're going to pinch the lobe and the pinna of the ears. And we're going to press all over the top and the back of the skull. We're going to go the neck and pinch the upper trapezius. Going to do the paraspinals all the way down, just inside the shoulder blades, supraspinatus area, infraspinatus area, lat muscles.
That's ticklish.
And we're going to go down the triceps.
That's a little sensitive.
Both sides.
Yep.
We're going to pinch the buttocks here.
No, that's ticklish.
Both sides.
Yep. And that's ticklish. Still ticklish. It's very ticklish.
Back of the knees.
Still.
Calf muscles.
It's slightly ticklish.
Both sides still.
Very ticklish, yeah. Not ticklish.
Not?
No.
Okay. Lay on your back. Now we're going to do the tragus of the ears, either side of the face. forehead, cheeks, jaw, nose, under the jaw here. We're going to go around the orbits of the eyes. We're going to go on the eyeballs themselves. Any of those?
Just feel weird.
Here, here, here,
That's sensitive.
both sides,
Oh, yeah.
biceps, any of that?
No.
There,
A little sensitive in the joint,
there,
like elbow. That's a little sensitive right here.
there,
Nope.
here,
Nope. Ow. Right here, it hurts.
same as the other side, correct?
Yeah. Same in that little webbing between my thumb and forefinger. In between all the webs, actually.
Okay.
That's a little sensitive / hurtful.
Okay, so is this in between all the webs also?
Pinch him a little bit. Yeah. Yeah.
Okay, now if we got a woman here, we're going to use her fingers.
Ow.
Just on one side.
It like hurts both, like right here.
Okay, let's take your arms up here.
That's ticklish. Oh my god. Same for everything that happened. Ticklish, ticklish.
Both sides.
Yes. Not so much anymore. Yeah. In the middle of the thighs.
Down here.
That just feels weird.
Here.
No.
There.
No.
Here.
No.
Here.
No.
There.
It's a little ticklish on the bottom of the foot.
Here.
Nope. That's ticklish. Ah.
Here.
Yeah, a little bit.
Inside or outside?
And like this part right here.
Okay.
Yeah.
Not as bad over here.
No.
There.
No.
You didn't feel anything on your eyes.
No. The eyes just felt weird.
Okay, but all through here you did feel ticklish, right?
Yeah. Especially on the back of
And
the
you
foot,
felt
that's
it on the
painful.
webs here?
Only okay. Only on the webs that are next to the finger next to or the toe next to the big toe.
Okay, so here and here,
Yeah.
but not here and here.
No.
Okay. So here we're going to take the weakest link, and since this would be the smallest sensitive spot, we're going to touch that here. Here, just as with the muscles, we're talking about the weakest link and undoing things. So you would locate the smallest by area painful or hypersensitive spot. And it does not mean that it has to be the most sensitive. It could be the least sensitive spot. But it's the smallest spot that is tender, sore, painful, just plain hurts, hypersensitive, or ticklish. Smallest by area. You locate that, and you go and you touch the exact opposite side 2 or 3 times just like that. You go back, and the only ones that will be still there will be the ones that are severely inflamed. but they'll reduce by half about immediately, and it'll take a while for those to go down. But basically, this is a shortcut on getting rid of non-scar trigger points. And you can do this very quickly and efficiently, save a lot of time and effort for you doing it, a lot of treatments, save a lot of money for the patients also.